President Conference, I've been flown in an aeroplane, but I'm not qualified to fly a plane. I've been treated by a dentist, but I'm not qualified to perform dentistry. I've received counselling for my mental health problems, but I'm no more qualified to offer focused and wholly appropriate counselling than I am to perform the former two tasks. So why would the government so undervalue the cost of providing properly trained individuals to fulfil their ambition of having a mental health first aider in every school by 2020? In the first year of the programme, the Youth MHFA organisation has provided 100 one-day courses to around 1,200 individuals. The cost of funding an individual course is around £200. Well, Conference, I'd suggest that to train staff to an adequate level in order to enable them to support children with mental health issues would actually cost way in excess of this amount. Furthermore, the idea that bundling around 120 staff at a time onto a one-day course is never going to offer sufficient detail of training to enable those staff to fully deal with the ever-escalating crisis in mental health issues in children from primary age up to university students. Put simply, in their usual haphazard way, this government is applying a sticking plaster to fix a gaping wound. Conference, in order to even begin to deal with the crisis in young people's mental health, it's not enough to look at the cure. We need to look at the roots of the problem and in doing so seek prevention. Recently, I attended what's a very rare event for teachers. I attended a CPD course that genuinely made me think. The session was based on the concept of load theory. Now, many of you will know that this load theory is based on the capacity of the working memory and the limited information that our working memory can process. Even though there have been many creditable studies into the concept of load theory and the dangers of overloading young people's working memories, this Easter holidays, children across the country are being bombarded with revision timetables. This ceaseless attack coming from all directions. Even yesterday, Barnaby Lennon, chairman of the Independent Schools Council, published advice arguing that GCSE students should be revising for 7 hours a day over the Easter holidays. No wonder these still developing young minds are going into meltdown at the prospect of page after page of information, pushing their working memory beyond capacity. Conference, in 1986, the barbaric practice of corporal punishment was quite rightly banned from our schools. Why now, in the 21st century, are we allowing a form of cognitive corporal punishment to pervade in our classrooms? The Guardian recently published figures showing that 16 million people in the UK suffer from some form of mental health illness. 3/4 of these illnesses originate in childhood. Additionally, 73% of children with mental health problems are not receiving the proper treatment for their condition, and furthermore, it takes an average of 10 years for children to receive adequate treatment to deal with their conditions. Conference, as teachers, we implement Wave 1 intervention in our learning every day. At the front line, we also deliver Wave 1 intervention for our children's mental well-being. But now the government must put its money where its mouth is and properly fund properly trained professionals to look after our children's mental health. To paraphrase something Kevin Courtney said a couple of years ago, we know the cost of fully funding children's mental health services. We do not know the price we will pay if we don't properly fund this provision. Please back this motion.
Thank you, Gary. I call Paul Power from Haringey to speak for.